Imagine a really bitter, freezing winter day. You step outside, and within a few minutes, you totally expect the skin on your hands to get a little dry, maybe, mildly chapped.
Yeah, just normal winter stuff.
Right, it's annoying, but completely normal. But what if that simple drop in humidity triggered severe, actual tearing physical trauma in your body's most sensitive, intimate areas?
It's a terrifying thought, honestly.
Welcome to the deep dive. Today, we are answering a highly specific, fascinating question. Does the weather actually dictate the severity of a complex, often misunderstood skin condition called lichen sclerosus, or LS?
And it's a question that completely reorients how we think about this condition, across the board.
Because we've got a great stack of sources today, right?
We do, yeah. When you look at the clinical guidelines from the NHS, the Mayo Clinic, and some really specialized data from places like the Women's Health Clinic and the Cadogan Clinic, plus insights from Klein Physical Therapy, a very clear picture emerges.
The environment plays a massive direct role.
A massive role. The weather absolutely dictates how this disease behaves.
So we are going to unpack exactly what's happening at a microscopic level, because understanding the mechanics here it's a total game changer if you or someone you know is dealing with this.
Absolutely.
Think of healthy human skin like a finely tuned, climate-controlled greenhouse. You have all these delicate systems: temperature regulation, moisture barriers, structural integrity.
Right, all working together.
Exactly. And when the weather outside goes to extremes, those internal systems adapt. But with LS, the climate control is just entirely broken.
Broken is the perfect word for it. Let's look at what actually happens during a summer heat wave.
Oh, summer sounds like a nightmare for this.
It really is. The ambient temperature spikes, and the body's natural cooling mechanism kicks in, which means we sweat.
Right.
But for someone with lichen sclerosus, that sweat is incredibly destructive.
Yeah.
The excess moisture gets trapped, particularly in the intimate genital and anal areas where LS typically presents.
Because sweat isn't just pure water.
Well, exactly, no. It contains trace minerals, salts, urea. So when that sits on vulnerable skin, combined with just the everyday friction of walking or moving.
It acts almost like a mild abrasive.
Yes, exactly like an abrasive.
Wait, so let me clarify this. Is it the actual ambient temperature itself altering the disease? Does heat somehow mutate the cells and make the disease more aggressive?
Oh, no, not quite. The underlying pathology of the disease isn't changing just because it's August instead of December.
Okay.
The weather is altering the localized microclimate. It's creating this swamp of trapped moisture, salt, and friction.
And the skin just can't handle it.
Right. The skin affected by lichen sclerosus simply does not have the structural resilience to withstand that environmental shift. It severely irritates the area and intensifies the baseline symptoms.
Then we flip the calendar to winter, and you face the exact opposite environmental threat.
You really do. Plunging temperatures bring dry air, and indoor heating drops the ambient humidity levels even further.
Which feels awful on healthy skin anyway.
Oh, yeah. But this cold, dry air causes something called transepidermal water loss. It literally pulls moisture out of the skin via osmosis.
Wow, just sucks it right out.
Exactly. And because the skin barrier in someone with LS is already so compromised, it just can't hold on to its hydration. We aren't talking about, normal winter flakiness here.
Right, we're talking about trauma.
Yes. We are talking about rapid, painful skin cracking, severe burning, and intense itching.
Which totally makes sense of the clinical advice emphasizing constant weatherproofing of the skin.
Yes, weatherproofing is key.
The guidelines specifically push for dressing in breathable layers, like loose cotton, to allow air circulation in the summer, and then applying specialized emollients or vulvar oils to manually trap moisture in the winter.
Which you have to be so diligent about.
But seeing how violently the skin reacts to just a little sweat or some dry air really begs a deeper question, I think. Why is this specific tissue so uniquely defenseless?
To understand that vulnerability, we have to look at what lichen sclerosus actually is at a biological level.
Okay, let's get into the biology.
So, it is a chronic, non-contagious inflammatory skin disorder. Dermatologists often describe its presentation in a figure-of-8 pattern around the genitals and the anal region.
Though it can show up elsewhere, right?
Yeah, it can sometimes appear on the wrists, upper trunk, or neck, but the intimate areas are the most common.
And the physical symptoms sound just agonizing. Pale, shiny patches of skin, intense itching, small blood blisters.
It's incredibly painful.
But the most alarming symptom in the clinical literature is the severe skin fragility. Let's go under the microscope here. What is destroying that resilience?
Well, it starts with the immune system making a really profound mistake.
A mistake.
Yeah. The body's own inflammatory cells, specifically T cells, begin migrating to the exact junction where the top layer of your skin, the epidermis, meets the deeper foundational layer, the dermis.
Okay, so they're gathering right at that boundary.
Right. And once they gather there, these T cells start releasing chemical messengers called cytokines.
And those cytokines are essentially biological alarm bells, right?
Yeah.
Alerting the body to an injury that doesn't actually exist.
They are, and the chaos they cause is highly destructive. These particular cytokines disrupt the normal production of collagen and actually halt the regeneration of skin cells.
Oh, wow. So the skin just stops repairing itself.
Exactly. Because the skin isn't regenerating properly, the epidermis thins out drastically. In medical terms, this is called epidermal atrophy.
Epidermal atrophy.
Right, the tissue loses its elasticity, its thickness, and its defensive barrier.
You know, the best way to visualize epidermal atrophy, I was thinking about this, it's like wet tissue paper.
That is a very accurate, very grim analogy.
Right. Normal, healthy skin is like a thick piece of canvas. You can stretch it, fold it, expose it to a dry winter wind, and it just bounces back.
Yep, it's resilient.
But skin experiencing epidermal atrophy is like a sheet of single-ply tissue paper that's been soaked in water. It has no structural integrity left.
None at all.
Just the everyday friction of walking, sitting down, or even the fabric of your pants shifting can cause that tissue to physically tear.
And that fragility is exactly why the weather impacts the disease so severely. When your skin is as vulnerable as wet tissue paper, a drop in humidity doesn't just dry it out, it causes microtears.
And then the cycle just worsens.
Right. Because that top layer of skin is essentially destroyed, any external force, whether it's a dry winter breeze or chafing thighs in July, sets off an immediate compounding reaction.
Which introduces a phenomenon that completely fascinated me in the research. The doctors refer to it as the Koebner response.
Ah, yes. The Koebner response is central to understanding how to live with LS.
Tell me about it.
It describes a phenomenon where trauma, friction, or damage to the skin actually induces the disease to flare up in that exact spot.
Wait, really? So the damage causes the disease to attack that specific area?
Exactly. When the skin tears, say, from winter cracking, the immune system rushes in to heal it. But because the immune system in an LS patient is confused, it doesn't send healing factors.
What does it send?
It sends more of those inflammatory T cells.
Oh, wow. So the disease is actively looking for areas of irritation. It means everyday life becomes an absolute minefield for you.
It really does.
The medical consensus lists things that most people don't think twice about, like tight jeans, synthetic tights, chinky seams on underwear.
Oh, seams are a huge issue.
Even fragrance soaps, bubble baths, standard panty liners, they're all massive triggers for the Koebner response.
It requires a really fundamental shift in daily habits. The clinics strongly advise switching entirely to 100% cotton, bamboo, or silk underwear.
Just to get rid of the friction.
Exactly. Simply because those materials reduce friction and allow the skin to breathe. Some specialists even recommend going underwear-free under loose clothing whenever safely possible.
Wow, just to eliminate the physical friction of a seam against the skin.
Yeah, it makes that much of a difference.
But, you know, clothing and weather are external. There's a biological internal irritant that people deal with multiple times a day that we definitely have to talk about.
Yes.
And that's urine.
It's a huge factor. Urine is inherently acidic, and it carries concentrated waste products like urea and ammonia.
Which sounds terrible for fragile skin.
It is. When urine comes into contact with skin that is already stripped of its protective barrier, it stings intensely. More importantly, it acts as a chemical irritant that further damages the epidermal layer.
Which triggers, let me guess, another Koebner response.
You guessed it, another Koebner response.
But the literature offers a remarkably simple, effective fix for this, which I loved. The Peri bottle.
The Peri bottle is a lifesaver.
It's just a small, squeezable bottle with an angled nozzle. You fill it with warm water and gently rinse the area while or immediately after using the toilet.
It dilutes the acidic urine and washes it away.
Right, without the need for harsh, abrasive wiping with dry toilet paper. Using water to neutralize a chemical irritant is such a brilliant, low-tech defense against a major trigger.
It is highly effective. But, managing friction and hygiene only goes so far.
Because of the internal triggers.
Right. There are internal triggers that are significantly harder to control, like hormones.
How do hormones play into it?
Well, when estrogen levels drop, which naturally happens during menopause, postpartum, or while breastfeeding, The skin intrinsically becomes thinner and produces less natural moisture.
Oh, I see.
For someone with LS, this natural thinning compounds the epidermal atrophy caused by the T cells. It makes the skin even more susceptible to winter dryness or summer chafing.
Okay, the hormonal mechanics make total sense. But I stumbled on another internal trigger in the research that really caught me off guard.
Emotional stress.
Yes. The clinical data clearly states that a period of high emotional stress can manifest as a severe physical LS flare-up.
It absolutely can.
How does a bad day at the office or anxiety over a deadline physically translate into tearing skin?
It really highlights just how deeply interconnected the brain and the immune system actually are.
It's wild.
When you experience acute or chronic emotional stress, the hypothalamus in your brain signals your adrenal glands to flood your body with cortisol and other stress hormones.
Right, the fight or flight response.
Exactly. And cortisol's primary job in a fight or flight scenario is to suppress non-essential functions, including the regulatory parts of your immune system.
So the stress hormone acts like a gag order on the very cells that are supposed to keep the immune system in check.
Precisely. It suppresses the regulatory cells, which allows the inflammatory T cells to just run rampant. Systemic inflammation levels rise across your entire body.
That makes so much sense.
Furthermore, people under high stress tend to unconsciously hold tension in their pelvic floor muscles.
Oh, I do that all the time without realizing it.
Most people do. And that chronic muscle tightening can restrict local blood flow and heighten nerve sensitivity in the exact area where the LS is most active.
Wow.
So, a bad week at work creates a biological environment where the inflammation spikes, the nerves are hypersensitive, and the skin barrier degrades further.
It's staggering to realize your skin is reacting on a cellular level to your stress. You are battling cold winter air, the friction of your clothing, the acidity of your own biology, and your emotional state.
It's a lot to manage.
With so many variables constantly attacking this fragile tissue, how does modern medicine actually step in? What does the treatment protocol look like when a patient finally gets this diagnosis?
The most important thing to establish right away is that while there is currently no permanent cure for lichen sclerosus, it is a highly treatable condition.
That's reassuring.
It is. The absolute gold standard of care across all the medical literature is the use of ultra-potent topical corticosteroids. Clobetasol propionate is the one most frequently prescribed.
See, the term ultrapotent sounds really intimidating. Why does the medication have to be that aggressive?
It comes back to where the battle is actually happening. Those T cells releasing cytokines aren't sitting on the surface of the skin.
They're deeper down.
Right. They're gathered deep down at the dermal-epidermal junction. A weak, over-the-counter cream like standard hydrocortisone just cannot physically penetrate deep enough to reach them.
Got it.
You need an ultra-potent steroid because it has the chemical ability to diffuse all the way down into the deeper layers of the tissue.
And once it gets down there, how does it actually stop the inflammation?
It operates on a genetic level, which is fascinating. The steroid molecules bind to glucocorticoid receptors inside the inflammatory cells.
Okay, getting scientific here.
Stick with me. Once bound, they literally enter the cell nucleus and turn off the specific genes responsible for producing those alarm bell cytokines.
Oh, wow. They're confiscating the alarm bells right at the source.
Exactly. Preventing the cells from sending the signals that cause the skin to thin out.
That makes the strictness of the regimen super understandable. The guidelines suggest a very intense starting phase, right?
Very intense, yeah. Usually applying the ointment daily for a full month to forcefully shut down that cellular alarm system.
And then you taper off.
Then the patient tapers down to every other day, eventually landing on a maintenance dose, like applying it twice a week long term.
And that steroid regimen is always paired with the heavy use of emollients, right?
Yes, always. Emollients are thick, unperfumed, greasy moisturizers. They aren't meant to be rubbed in like a vanishing lotion. They are meant to sit on the surface.
Like a shield.
Exactly.
Right.
Patients use them as soap substitutes when washing to avoid stripping the skin, and they apply them constantly as barrier creams.
Going back to our greenhouse analogy, if the steroids are fixing the broken climate control system inside,
The emollients are the weatherproofing on the outside glass.
right, protecting the vulnerable structure from summer sweat, winter dryness, and everyday friction.
Perfect analogy.
But, you know, if you're listening to this and you or a loved one has just been prescribed this protocol, you're going to experience a very specific, very common moment of panic at the pharmacy.
Oh, the warning label.
Yes, you pick up this tube of ultra-potent clobetasol, and printed right on the label in bold, unavoidable letters is a warning. Do not use on genitals.
Yeah, it's terrifying.
And the doctor just told you to apply it exactly there. Why should a patient ignore that terrifying official warning?
That warning label creates an immense amount of anxiety,
Yep.
and understandably so. Those labels are mandated because on healthy, normal skin, the long-term application of an ultra-potent steroid can actually cause the skin to thin out and atrophy.
Wait, but thinning skin is exactly what the disease does.
I know it is the great paradox of this treatment, but here's the critical distinction. The skin affected by active lichen sclerosus is not healthy skin.
Right, it's already under attack.
Exactly. The inflammation caused by the disease is destroying the tissue at a rapid, violent rate. The damage caused by untreated LS is infinitely worse and more aggressive than any potential long-term side effect of the steroid.
So the steroid is saving the tissue.
Yes. When used correctly and monitored by a doctor, these steroids are incredibly safe for this specific application. They are the only proven method to halt the immune system from obliterating the tissue.
So you really have to look past the warning label because the alternative, like letting the disease run wild, has catastrophic consequences.
It really does.
The medical sources do not sugarcoat what happens if LS is left untreated or if someone stops their medication out of fear. The long-term stakes are severe, starting with the anatomical changes.
The anatomical changes are devastating. When the skin is constantly inflamed, tearing, and trying to heal over and over again in a chaotic way, it builds up dense scar tissue.
And medically, this process is called fusion, right?
Fusion, yes.
Mm-hmm.
As the scar tissue contracts, the actual shape of the anatomy alters.
The specifics of that fusion are difficult to read about. I mean, in women, the labia minora, the inner lips, can shrink and permanently fuse to the outer labia.
Yes, and the clitoris can become entirely buried under a thick layer of scarred tissue.
And the vaginal opening itself can narrow significantly.
The result is that basic, fundamental human functions like urinating or engaging in sexual intimacy become excruciatingly painful.
And in severe cases of fusion, physically impossible.
Right. And while reconstructive surgery exists to separate fused tissue, the clinical guidelines treat surgery as an absolute last resort.
Let me guess, because of the Kobner response.
Exactly. A surgical scalpel is the ultimate form of physical trauma.
Right.
Cutting into that tissue to separate the fusion almost guarantees a massive, aggressive new flare-up of the disease.
Which can sometimes result in even worse scarring during the recovery process.
It's a vicious cycle.
And beyond the scarring and the fusion, there's also a documented cancer risk associated with untreated LS, isn't there?
There is, and it requires lifelong vigilance. The sources agree that the risk is relatively small, typically less than a 5% lifetime risk. But poorly controlled lichen sclerosus can evolve into a type of skin cancer known as squamous cell carcinoma.
Because of the constant cell turnover.
Exactly. The mechanism here is chronic inflammation. When cells are constantly inflamed and rapidly turning over to heal microtears over decades, the chance of a genetic mutation occurring and leading to cancer increases.
Which is why the clinical guidelines hammer home the importance of lifelong self-examination.
Yes, checking regularly is crucial.
Patients are instructed to use a hand mirror regularly to inspect their skin, specifically looking for any lumps, firm nodules, or ulcers that do not heal even when the steroid cream is applied.
Catching those changes early is highly treatable, but it requires the patient to be intimately familiar with the baseline topography of their own skin.
Which can be psychologically daunting.
Extremely daunting.
Because the psychological toll is something we really cannot gloss over here. I mean, put yourself in the shoes of someone receiving this diagnosis.
It's so overwhelming.
You are dealing with chronic, searing pain in a highly intimate area. The weather dictates your comfort. Your clothing hurts.
Yeah.
You are facing the risk of your physical anatomy permanently changing, a looming cancer risk, and the only defense is a medication with a terrifying warning label.
The anxiety and the isolation must be overwhelming.
Absolutely.
It is a massive psychological burden. The clinical data notes high rates of depression, severe body image issues, and profound strain on intimate relationships among LS patients. It fundamentally alters a person's quality of life.
I can't even imagine.
Medical professionals increasingly recognize that managing the mental health aspect through cognitive behavioral therapy, sex therapy, and patient support groups is just as crucial to the treatment protocol as prescribing the clobetasol.
But, you know, the truly empowering takeaway from all of this clinical data, the light at the end of the tunnel, is that proactive, informed treatment works.
It really does work.
Using that ultra-potent steroid and diligently applying those emollients doesn't just soothe the itching. It travels down into the cellular basement, switches off the cytokines, halts the epidermal atrophy, prevents the fusion, preserves the anatomy, and actively minimizes that cancer risk.
By understanding the biology, you are taking the control back.
Right.
Knowledge is the most effective tool a patient has. When you understand the why behind the symptoms,
Hmm.
why winter dry air causes a flare, why stress makes it worse, why the steroid is necessary despite the label, you remove the fear of the unknown.
So we started this deep dive with a question about the weather. Does it affect lichen sclerosus?
Yes, absolutely.
Winter draws the moisture out until the skin cracks, and summer traps sweat and friction until it tears. The weather is a powerful catalyst, but it's acting on a biological stage set by a confused immune system, inflammatory T cells, and the Kobner response.
It is a really complex interplay of environmental triggers and systemic biology. And before we finish, there is a final, highly provocative thought that emerged from the margins of these clinical sources that I think completely shifts how we view the future of this disease.
Oh, I love these. Is it the link to other conditions?
Yes, exactly. The clinical data repeatedly notes that lichen sclerosus frequently co-occurs in patients who already have diagnosed autoimmune diseases.
Like what kinds of diseases?
We were talking about thyroid disease, pernicious anemia, vitiligo, and type 1 diabetes. Yet within the strict definitions of medical taxonomy, LS itself is currently classified merely as an inflammatory skin condition, not officially a systemic autoimmune disease.
But wait, if the body's immune T cells are mistakenly attacking its own skin tissue, the autoimmune connection seems glaringly obvious, doesn't it?
It really does. And it raises an incredible question for the future of dermatological research. If lichen sclerosus is truly a localized manifestation of a broader systemic autoimmune failure, then perhaps the ultimate cure won't be found by studying the skin at all.
Where would they look instead?
Well, they might need to look at mapping the gut microbiome, which controls a massive portion of our immune regulation.
Oh, wow.
Or they might need to unlock the genetic sequencing that causes T cells to misfire in the first place. If medical science can identify and correct the root coding error within the broader immune system, we might one day be able to intercept those inflammatory cells long before they ever reach the dermal junction.
We wouldn't just be weatherproofing the greenhouse or putting out fires, we'd be rewriting the climate control software from scratch.
Exactly.
That is a deeply hopeful frontier to think about. Whether you are navigating an LS diagnosis, supporting a partner, or just fascinated by the complex ways our bodies interact with the world around us, we hope this exploration gave you the why behind the what.
Stay curious.
Stay informed, and we will catch you on the next deep dive.